Okay, dear all, Dr. Vishal from Vishwa Medical Coaching, and this is one of the very important image, or I can say video we are making, where we are going to study the different type of tests we perform on the legs. Now we have collected these three tests together, and these three tests are performed as you see in the picture for different pathologies. There is a different technique and there is a different interpretation. Like for example, let's say for example, many of you become confused about what are these tests. Now first one, as you see in the picture, is a test called as an HOMANS test, is also called as an HOMANS sign. As you see in the picture, what exactly the examiner does is to hold the thigh with one hand and flex the thigh and flex the knee little bit, as you see in the picture, and we dorsiflex the ankle joint and look for the pain that is produced in the calf. Now this test is done for a deep vein thrombosis. For the deep vein thrombosis, and if the patient has got deep vein thrombosis, patient produces pain in the calf region. Pain in the calf region. Initially the test was performed differently by squeezing the calf, but nowadays it is not performed for the risk of getting a thromboembolism. The other test, as you see in the picture, is the test called as a Kernigs test or a Kernigs sign. Now this test is also performed in the legs, but the technique is different. This test, as you see in the picture, we first flex the thigh and flex the knee, and then we give pressure on the knee and extend the knee joint and look for the flexibility of the hamstring muscles. Now, if you are not able to extend the knee, then it is a possibility that the hamstring muscles are tight, and this can be because of meningitis. It's commonly called a Kernig sign. Commonly called as a Kernig sign. And the third test, as you see in the picture, is an SLR test. This is the straight leg raising test. Now, this test we extend the knee joint and keep the leg straight and ask the patient to raise the leg as you see in the picture. Normally up to 60 to 75 degree there is no pain that is produced, but if the patient produces pain in the back of the thigh and a tingling numbness, there is a possibility of a slip disc or a sciatica, commonly also called as a sciatica. Now deliberately we have collected these three tests together because these three tests are performed in the legs, but for different reasons, different pathologies, and a different technique and different interpretation. Okay? Thank you very much. Do share to your colleagues this video if you like, and keep learning and keep enjoying. Thank you so much.